Here's the uncomfortable truth. If you've been told there's no way to increase penile length, you've been lied to. I'm Dr. Samuel Boyd, and in this video, I'll show you the methods backed by clinical trials, the same ones urologists quietly use with patients who ask the question every man secretly wants answered. Can I actually make it bigger? The answer may surprise you. Now, I want to be very clear. This isn't about miracle pills, magic creams, or shady online devices that promise overnight results. If you've searched the internet, you've seen those claims. They play on insecurity, but they never deliver. What we're discussing today is medicine, science, and techniques with proven results. Some methods work slowly, some require dedication, and some carry risk, but the science is there, and it's time you hear the truth. Let's start with the facts. The average man, according to large-scale studies published in the British Journal of Urology International, has a flaccid penis length of about 3.6 inches and an erect length of around 5.2 inches. That is normal. The problem is perception. Men often believe they are below average, when in reality, they are within range. Still, for those who want enhancement, modern medicine does provide options that can increase size, modestly but measurably. The most well-documented method is penile traction therapy, delivered through medical devices called penile extenders. These apply gentle, sustained stretching to the penis over long periods of time. Multiple clinical trials, including studies in the Journal of Sexual Medicine, confirm that regular use can increase length by 1 to 2 centimeters after 6 months or longer. This is not a scam. It's basic biology. Tissue exposed to gradual tension adapts, remodels, and expands. Now, traction therapy isn't quick. It requires wearing the device for several hours a day over many months. That's why so many men give up before seeing results. But for those who stay consistent, the gains are real, and the safety profile is relatively strong. Side effects may include temporary discomfort or redness, but when used properly, these devices are far safer than surgical shortcuts or unregulated injections. Discipline is the trade-off for safety and results. Speaking of surgery, let's discuss one of the more controversial options, ligamentalysis. This is a procedure where a surgeon cuts the suspensory ligament of the penis, releasing additional internal length that is normally hidden inside the pubic area. The effect is often most visible when flaccid, but erect length may not increase as dramatically. Risks include scarring, instability, or dissatisfaction with appearance. Surgery should be considered a last resort, not a first-line solution. Another option that deserves clarification is vacuum erection devices, often marketed as penis pumps. Most men think of these as tools for erectile dysfunction, and that is their primary medical use. However, studies suggest that regular, structured use can also create modest length increases. By using negative pressure, the device draws blood into the penis and stretches tissue. The challenge is consistency, and the results often fade unless combined with ongoing therapy. Lifestyle also plays a critical role in penile size and function. Obesity, poor circulation, and low testosterone can all make the penis appear smaller or perform worse. In fact, men who lose significant belly fat often see up to an inch of additional visible length, simply because fat no longer buries the base. That's not an illusion. It's a reclaiming of what was already there. Improving vascular health through diet, exercise, and hormone balance doesn't grow new tissue, but it maximizes what you have. In recent years, regenerative medicine has entered the conversation. Platelet-rich plasma injections, sometimes called the P-shot, aim to use growth factors from your own blood to stimulate tissue repair and potential expansion. Early studies suggest improvements in erectile function, but evidence for actual length gains is limited and inconsistent. While promising, PRP should be seen as experimental at this stage. Long-term trials are still needed before we can consider it a proven enlargement method. Now let's tackle one of the biggest myths: pills, supplements, and herbal concoctions. No capsule has ever been proven in peer-reviewed studies to increase penile length. Ingredients like L-arginine, ginseng, or maca may improve blood flow and help with erection quality, but they do not cause tissue expansion. A firmer erection may appear larger, but that's function, not structure. Men deserve honesty here. There's no supplement on the planet that adds inches. What about timing? Many men ask me when the best age is to start. The truth is, penile growth stops at the end of puberty. After that, structural changes only occur through mechanical or surgical intervention. Younger men may adapt faster to traction, but older men can absolutely see results if they are patient. Age is less important than consistency, health, and dedication. This isn't about youth, it's about discipline. Expectations are another key point. If you begin traction therapy at 5 inches, you're not going to end up at 9. Gains are typically in the range of 1 to 2 inches with long-term use. For some, that is life-changing. For others, counseling may be a better solution than chasing unrealistic goals. I've seen men improve their confidence dramatically by simply learning they were already normal. But for those who pursue enlargement, realistic expectations prevent disappointment. Confidence itself is often the hidden issue. Studies show that men who believe they are too small often underestimate their partner's satisfaction. Women, in survey after survey, rank emotional connection, confidence, and intimacy above size. That doesn't mean size is irrelevant, but it does mean your mindset can impact satisfaction as much as your body. Sometimes building confidence through fitness, therapy, or focusing on sexual technique is more powerful than chasing extra centimeters. Still, for those who are committed, the scientific pathway is clear. Traction devices are the most proven non-surgical method. Surgery exists, but should only be used in extreme cases. Vacuum devices can be supportive. Regenerative medicine may one day add more. Lifestyle improvements can reveal and maximize natural length. And every man must remember, pills and miracle cures are lies. The truth requires time, consistency, and medical guidance. So, let's answer the original question head-on. Can penile length actually be increased? Yes, but only modestly, only through proven methods, and only with patience. No doctor can promise massive gains. But for men who commit to the right methods, the difference is real, the science is sound, and the results can change not just their body, but their confidence and relationships as well. Here's my advice as a urologist. If enlargement is something you're considering, don't go it alone. Consult with a qualified specialist, discuss your goals, and choose methods with evidence behind them. Avoid scams, avoid risks, and don't let insecurity push you into dangerous territory. The truth is better than the lie, and your health is worth more than any promise of overnight transformation. Gentlemen, size matters less than confidence, health, and intimacy, but that doesn't mean science leaves you powerless. The tools exist. The data is clear. And with discipline, you can achieve measurable results safely. What matters most is combining knowledge with wisdom so that your pursuit of improvement builds confidence instead of destroying it. That is the real victory, and that is why the truth matters. I'm Dr. Samuel Boyd, and I hope this video has given you clarity, honesty, and a path forward. If you found this valuable, subscribe now for more expert insights on men's health, intimacy, and vitality. Leave a comment with your questions, and share this with a friend who needs to hear the truth.